Hello dear friends, how are you doing today? I hope you are doing well. Welcome to a new question about dermatology. A 45-year-old woman presents for review. She has noticed several patches of pale skin on her hands over the past few weeks. The patient has tried using an emollient and topical hydrocortisone with no result. On examination, you note several depigmented patches on the dorsum of both hands. Her past medical history includes thyrotoxicosis, for which she takes carbimazole and thyroxine. What is the most likely cause of her symptoms? A. Vitiligo. B. Carbimazole-induced hypopigmentation. C. Leukopenia-induced fungal infection. D. Idiopathic guttate hypomelanosis. And E. Addison's disease. Okay, here we have a 45-year-old woman coming with chief complaint of several patches of pale skin on their dorsum or her hands for past few weeks. The patient used an emollient and a topical hydrocortisone, but there was no any result. On examination, we can see several depigmented patches on the dorsum of both of the patient's hands. And the patient past medical history is important of thyrotoxicosis, which the patient is using carbimazole and thyroxine for this problem. Okay, according to the sign and symptoms and our review and the patient's past medical history of thyrotoxicosis, the most likely diagnosis is vitiligo, and here we are going to explain it. As we said, the answer is vitiligo. Explanation: vitiligo is more common in patients with known autoimmune conditions such as thyrotoxicosis. There is nothing else in patient's history to suggest Addison's disease. There is a relation between vitiligo and Addison's disease also, but in the patient history there is nothing to mention Addison's disease. Vitiligo is an autoimmune condition that results in the loss of melanocytes and consequent depigmentation of the skin. It is thought to affect around 1% of the population, and symptoms typically develop by the age of 20 to 30 years. Pathogenesis of vitiligo. Autoimmune mechanism is the most accepted theory. The body's immune system mistakenly attacks melanocytes. Genetic factors, oxidative stress, and neural factors may also contribute. Clinical features and presentation of vitiligo lesions. Lesions, depigmented milky white, well-defined patches are present on the different parts of the patient's body. Distribution commonly on the face, hands, arms, feet, and around body openings like mouth, eyes, and genitals, but the peripheries tend to be most affected. Hair involvement, sometimes hair in the patches turns white, or we call it poliosis. As we can see here, we can see the parts of vitiligo on the face of this young man, and here we can see also the parts of vitiligo on the dorsum of hands, around the openings like around the mouth, nose, and around the eyes of this beautiful girl. Here we can see the vitiligo lesions on the back of hands and on the back, neck, and on the face of this beautiful girl. Here we can see the vitiligo patches around the eyes, around the mouth, hands, and forehead of this beautiful girl. Here we can see the involvement of the surface of the body, hands, and face of this beautiful girl. Types of vitiligo: generalized vitiligo, widespread symmetrical patches is most common. As we can see here, we can see widespread symmetrical patches on the body surface and face of this beautiful girl, and it is a widespread type or generalized vitiligo. Segmental vitiligo, localized to one side or dermatome, and a focal vitiligo, we can say isolated spots. Risk factors and associations of vitiligo: family history and genetic predisposition is important. Autoimmune disease like autoimmune thyroid disorders, type 1 diabetes, pernicious anemia, alopecia areata, and Addison's disease. As we can see, our patient has autoimmune thyroid disorder or thyrotoxicosis. Trauma, which we call it Koebner phenomenon, stress or sunburn may trigger lesions. Diagnosis of vitiligo, clinical examination is usually enough. Blood tests like thyroid function and autoantibody screening, if associated autoimmune disease is suspected, can be helpful. Whose lamp lesions appear bright white under UV light. As we can see here, we can see bright white lesions under UV light of Wood's lamp. Here we can see also bright white lesions under the UV light of Wood's lamp. Management of vitiligo. Note, vitiligo has no permanent cure, but treatments can improve repigmentation and appearance. General measures: sun protection to avoid burns on the pigmented skin, and cosmetic camouflage like makeup and self-tanners can be helpful. Medical treatments: topical corticosteroids for localized disease may reverse the change if applied early. Topical calcineurin inhibitors like tacrolimus, pimecrolimus are useful on the face and sensitive areas. Phototherapy with narrowband UVB or PUVA can stimulate melanocyte activity, and this is important. Systemic steroids in rapidly progressive vitiligo can be helpful. Surgical options for stable vitiligo or focal vitiligo. Skin grafting and melanocyte transplantations can be helpful in focal vitiligo. Adjuncts like vitamin D analogs and antioxidants can be helpful. Prognosis of vitiligo: course is unpredictable. Some patches may remain stable, others may expand. Segmental vitiligo tends to be more stable than generalized vitiligo. Early treatment can sometimes lead to repigmentation. There is a question which lots of patients ask that: does dietary regimen has effect on progression or worsening or improvement of vitiligo? I want to say that there is no any scientific data for improving this idea that dietary regimen has effect on vitiligo. But there is some evidence that vitamin D analogs and antioxidants and foods rich with antioxidants can help to improve the lesions, but there is no any scientific data for food regimens like avoiding or drinking milk or eating eggs or fish. There is no any scientific data about this idea. Okay, this was a short explanation about vitiligo presentation and management. We talked about a different type of skin disease presentation and management on our YouTube videos. For more information, you can watch them. Thank you for your attention.